You're listening to Girls with Grafts, a burn community podcast created by Phoenix Society for Burn Survivors, a leading nonprofit dedicated to supporting the burn community. In this podcast, we'll talk with burn survivors, share resources to help with supporting and improving burn recovery, and discuss how to prevent burn injuries. Here are your hosts, burn survivors and Phoenix Society's marketing team, Amber Wilcox and Rachel Kudlak.
Hello and welcome back to Girls with Grafts. I am Rachel Kudlak. I'm one of the hosts of the podcast, and I'm joined, as always, by my lovely co-host, Amber Wilcox.
Good morning. Well, super excited for today's podcast, but before we do, we'd like to give a special shout out to our podcast sponsor today. So Rachel, would you be able to introduce that sponsor?
Yes, so today's podcast is powered by the DC Firefighters Burn Foundation. The DC Firefighters Burn Foundation is dedicated to assisting in the recovery and rehabilitation of injured firefighters and burn survivors. And you can learn more about them by visiting their website at www.dcffburnfoundation.org. And we'll have that linked below in our show notes as well.
Awesome. Well, today's guest is a burn and trauma surgeon, which is very exciting. We have not had many surgeons on this podcast. So without further ado, Rachel, would you go ahead and introduce her so we can bring her on the show?
Yes, so today we are excited to welcome Dr. Callie Thompson, who is a burn and trauma surgeon by training. She specializes in the care of thermally injured patients and other skin and soft tissue diseases that require surgical intervention. Her research is focused on implementing changes to care delivery that improve patient-centered outcomes for burn survivors and engaging burn patients as equitable partners in the entire research process. So welcome on, Callie. Thank you so much for joining us today.
Thank you so much for having me.
Callie, it is a pleasure to have a surgeon on our show today. And before we kind of dive into some questions about what you're currently working on, I'd love to know a little bit more about kind of your career and how you get started in burn surgery.
Yeah, so I actually, I was never going to be a surgeon. I was going to be a pediatrician. And I think that kind of explains maybe my personality and what I love to do now. But I went into surgery thinking I would then do pediatric surgery. And then when I was a resident, which is when you're training to be a surgeon, I just fell in love with burn and trauma. So I got to rotate on the burn service as a third-year resident. And the thing that I loved about it most of all was that I really got to know people, and I really got to see this evolution of their care and going from being very sick and really like everyone doing everything for them to having someone who's walking out of the hospital after a really long, hard, hospital course, and just so much work on their own part, like individuality, really just stepping up and getting themselves well. And I just kind of fell in love with that whole continuum. So I started doing, when I started my career, I started doing burn and trauma, and I've really isolated into the care for burn patients as my sole clinical practice. And that's because I find that there's so much to do and so many areas where we could do better. And that's where I want to spend my time.
That's awesome.
Yeah, thanks for sharing that with us. So I think you alluded to this a little, but tell us a little bit more about your burn care research.
Yeah, so my research is focused on how do we improve the quality of life for burn survivors. I love taking care of burn patients. It's obviously what I do day in and day out. But really what I see in that care for burn patients is I love helping someone become a burn survivor. And to me, it's not just enough to say, oh, you got out of the hospital, congratulations. What I really want to do is look at after people go home and what life looks like after they recover from that initial hospital stay or that initial burn injury. And so that's where I decided to focus my research, is how do we address any concerns that someone might have once they go home that's really impacting their quality of life. And what I realized in that can you guys hear that? Can you hear that like thing from okay, sorry. My email was buzzing, so I wanted to make sure you couldn't hear it. What I really wanted to be sure of when I started doing that research is that I actually knew what burn survivors, what were impacting their quality of life and what they wanted me to look at, because I have found that people who don't live and experience are really, really bad at guessing what someone else's life is like. And so that's kind of what started me on this journey with my most recent research project is, what if we just partnered with burn survivors and asked them what they wanted us to study? And that's where I got to where I'm at.
So let's talk a little bit about, you presented at the American Burn Association, so the ABA annual meeting. I believe this is the study that you're referring to. Can you tell us more about this study and kind of the findings?
Yeah, so we were very fortunate to receive a capacity building award from the PCORI Foundation, which is the patient-centered outcomes research and foundation. And we formed first a research collaborative. And the goal for the research collaborative was that it had to be run by the key stakeholders in the burn community, the majority of whom I think should be burn survivors. So we started by forming a research collaborative that's entirely governed by stakeholders, the majority of whom are burn survivors. Some of them are adults who were burned as adults. Some of them are adults who were burned as children. So there's really a lot of different perspectives, and that was important to us. There's also people who've sustained burn injuries that have required amputations, people who come from different racial and ethnic backgrounds, and formulating this research collaborative with a lot of different perspectives was important. So we started by forming this research collaborative. We call it the Burn Survivor Centered Outcomes Research Collaborative. We have shortened that to B-SCORE for ease of communication. And from that, we decided to hold what are called here at the University of Utah engagement sessions, but are very similar to focus groups, where you have kind of a set of questions, but you let it be more free-form, open sharing. And we actually held 16 of those engagement sessions. They were on 5 different topics, and those topics were agreed upon from our governance committee. So we had a bunch of meetings where stakeholders said, actually, this really bothers me, or I hear this a lot in support group, or, this is something that wasn't a problem when I was 8, but now is a problem when I'm 28. Let's think about that. And from that, we kind of came up with these 5 general topics: patient and family education, aftercare, navigating the healthcare system, and recovery, both physical and psychosocial or psychological. And then we also did a 5th topic. The 5th topic was barriers to research participation, because I really thought, okay, we're going to do all of this to find out what people want us to study, but what prevents people from actually being able to participate in these studies? And so we started there. We held the engagement sessions. Originally, we were only going to do 15, but kind of midway through, we decided to dedicate one of the aftercares to firefighters. And we decided to dedicate one of the recoveries to people with electrical injury survivors. And that was because both of those groups are relatively underrepresented in burn research. And I wanted to make sure that if we were getting all of these different viewpoints, there wasn't a group of people we were missing that maybe had needs that weren't what the general burn patient population or burn survivor population might have. So after we had all these engagement sessions, we had them transcribed. I had 26 hours of transcript that we got to listen to, read through all of these, read through all of the transcripts. And when you looked at them, both actually grouped, if you looked at all the aftercares together, for example, there was really clear themes. There were, even though each session had 8 to 10 people in it, throughout those 16 sessions, a lot of people were sharing the same concerns, the same challenges, the same hardships. And so we brought out these broader themes, and from those broader themes, we prioritized them through anonymous survey. The prioritization was done by that governance committee for B-SCORE. So also burn survivors, other stakeholders from the burn community, caregivers. And we created this prioritized list of 37 things that burn survivors or their caregivers want us to research.
That's awesome. So essentially what you did, especially with this study, is, we ask survivors all the time to complete research studies and, take 10 minutes and do this survey. But essentially what you did is you brought in all the survivors before you even put the survey together. Correct? Awesome.
Yeah, that's right. And I think, I have often thought throughout this whole process, first of all, reading the transcripts, I am just blown away by how because there are people that were participating in this that were my patients. And it was just very interesting to me to see my perspective on their injury and their own perspective on their injury, and especially a lot of the struggles that happened after they went home that I never knew about, that they didn't mention in their clinic visits. But I also think, like 10 times a day, if I had just tried to come up with what people wanted me to study, I would have been so very wrong. And so it is, starting from that, like the very first step, going all the way back was really important to us.
Definitely. And I love too how you, especially for the firefighters, giving them some extra attention and an extra focus group. We find too, if you're an injured firefighter, they tend to then kind of still identify as part of the fire service, which they are, but they maybe don't identify as much as a burn survivor themselves. So I love that you did that. So why, I guess, how did you come up with this idea? Or like, why is it so important to you that survivors and caregivers and these key stakeholders get involved earlier in the research process?
There is this theory called co-production in research, and it's very popular in Europe. It hasn't really taken off here in the US as much as it has, particularly in the UK, but it's doing research with the people who will use it or benefit from it. And the more I learned about this and the more I did this project, I realized that this was kind of the key to me to making the most impactful research projects and the most impactful research, answering the most impactful research questions. Because I think what eventually comes out of research where you co-produce it with survivors and other stakeholders is something that's going to have a greater impact on care delivery and potentially those patient-reported outcomes than if I had just made up the question and answered the question and, given the data. But if the data isn't something that, for instance, donor site location, I think a lot, as a surgeon, I think a lot about donor site location, the surgery that I'm going to do. If you search the transcripts for the word donor site, you will not find it. In 26 hours, not one person mentioned a donor site. And so I can do all the research. This is my own opinion. I can do all the research in the world about donor site locations or donor site healing. And if it actually isn't what's impacting someone's quality of life, I'm going to have very little impact on their quality of life. And so I really think that when you ask people and you involve people, it makes the product of your research better. But I also think there is a lot of strength and empowerment for the individual that gets to participate in that. And that also matters to me, just like any other aftercare or psychosocial support we provide a burn survivor or their family member. Having a voice and feeling like your voice is heard is really powerful, regardless of the forum that it's in.
I love that.
Absolutely. Well, I know that we talked a little bit about, right, like why they should get involved, but I think like the biggest struggle sometimes is how to become more involved with research. I know Phoenix Society shares a lot of that as well. So if you're not involved, for those listening to like our newsletter or things like that, we do send out regular studies or things that we have for folks to participate in. But is there any other ways, Callie, that that we can get survivors to continue to kind of speak up and be able to participate in that research you're talking about?
I think knowing about the research is a big challenge, which is why organizations like the Phoenix Society are really critical to getting out the information. We utilized the Phoenix Society when we were putting out our calls for participants. A lot of local burn organizations were also putting out calls on their social media. I think that having a central place where people can go to get information about the research projects is critical. But in our work, we also identified 19 barriers to research participation that are also going to be really important for researchers to be mindful of, because it's not just knowing about the research project, it's making it accessible. It's helping people overcome their geographical barriers, and I know we've gone virtual for so many things, which is great. That does help. Our study was entirely through Zoom, which meant we were able to get participants from 25 different US states, but not every study, sometimes you have to drive. And if you're already driving, our personal here in Utah, our catchment goes all the way up to Canada. And so if you're driving that far, having to come that far just for your appointments, it's going to be really hard to participate in research studies. So there are things like that I think researchers are going to have to be very mindful of. Being respectful of your participants sounds really like a very simple, silly thing to say, but that came out a lot. People didn't trust their researchers. They didn't feel like they had their best interest in mind. They didn't feel like the research was patient-centered. So I think there's getting the information out there, but I also think there's researchers doing a lot of work to heal and create trust and safety within the research projects to ensure that when someone has a research experience, it's positive so that they come back. And then the other thing we did that I'm very proud of, and because of our PCORI funding, we were able to do, because they really value that patient survivor expertise, we were able to pay everyone for their time, and not just like a $5 Starbucks gift card. We were actually able to pay people a substantial amount of money for their participation. And I think that really shows people that their expertise, my expertise is I have exactly zero expertise in being a burn survivor. And my expertise in this project is no more valuable than a survivor's expertise. So we should not be paid differently to participate. And that was what we went into the study for. So I do think it's getting out there, it's knowing that the research is happening, but also it's designing studies that limit the barriers and make it a positive experience for people who are participating.
I think that's important because, right, if I'm taking a day out of work as a survivor, like that could be a very difficult thing to realize that I may have to give up my time that I otherwise would use to make my living. So I think it's a great call out to make sure that you are adequately compensating for time, for sure.
Well, and I think another important thing, and Callie, you probably found this in some of your findings, is, we send out surveys, yes, but then it's hard to get survivors to actually see the findings or see what actually came from the research. And I know some of that's based on timing, because it's not, as you can take 15 minutes for a survey, but may take years for the research to come out. But I think that's one thing that, we can all really strive for, is making sure that survivors have access to this research, and then also making sure it's in a digestible format. Because I know sometimes I look at a paper and I'm like, this is all jargon to me. I don't know what they're saying. So
yeah, that's
definitely
really important. I apologize.
No, go ahead.
That's really important. And actually the PCORI requires everyone that they have a contract with to provide both a general, readable output and their own more scientific reports. So we were able to construct that through this work. And I think that's really important. We also did something that I have never heard of before, but that we have a community collaboration and engagement team here in Utah. And we heard this, like people said, oh, I participate in studies, but one of my barriers to participating again is that I had no idea what came from that, or I didn't even know if my time was worthwhile
Mhm.
or what the benefit of that was. And they do something called a return of results session. So we had 117 people participate in our engagement sessions. At the end of the study, we actually invited all of them back and did just a quick 30-minute Zoom explaining the results, explaining what we found, explaining what we're going to be publishing. And it was such a positive experience for me. People really liked it. I got a lot of cool emails afterwards with additions and other notes that people wanted me to think about. And I've written 5 grants since we closed that study, and I've actually budgeted in for a return of results section for every single one of them now, because the cool thing to make sure people actually saw, even before it's published, what is coming from the study.
Mhm. That's amazing. So you talked a little bit about this, of like having respect for those who are participating in the study, but what else, in your opinion, makes a good research project?
I think a good research project is thoughtfully designed, obviously not the scientific side of it, but I think it's thoughtfully designed to take into account the burden on a participant. So, for example, if you're wanting to study something that is happening, you want to study a time point 2 weeks after injury. I understand that it's important. That's important information to gather. But you have to be thoughtful about how stressful 2 weeks after injury is to the patient and their family or
Mhm.
their caregiver. And it's not that you shouldn't do the study, but I think it is coming into your participant pool and screening people and coming to them to ask them to be a part of the study with a level of humility required for what you're asking them. So if you're asking someone to give up a whole day of work and you're not going to be able to compensate them for exactly what their whole day of work is, then you should make it as easy as possible. So you should provide meals. You should ensure that they understand why they're doing it. You should schedule it on their schedule. So there's just thoughtful things. And I can't think of another word for it, but it really is just being thoughtful about the burden on other people. Um, I also think that there's a lot of pain related to recovery from a burn injury. And I think that people are fearful of signing up to be in a situation where they would have more pain than they've already gone through. So I think keeping in mind both the physical and potentially psychological pain that a study might cause and setting up safety nets for that. So I can't think of any particularly physically painful, but a lot of studies may be psychologically painful. They may be asking people to relive traumatic situations that they don't want to. So when you're designing a study, have you set up for them to have resources should they need additional psychological support? Do you have a social worker who can, do some counseling, or a psychologist, things like that, that are just thinking one step ahead, or at least a step ahead for someone else, and being more empathetic about your participants and what their lives are like and what they might need.
Mhm.
I think that's great because, yeah, I think reliving the trauma that I've had is something that like may prohibit me from wanting to go into a study, right? Like I don't really want to talk about that today. So maybe I don't want to sign up for that reason. So I think knowing, right, that you're setting up those not barriers, but like the assistance that exists there, I think is important because it can be very difficult. And so being mindful, right, about like what you're doing and kind of how you're approaching survivors, especially when there's a lot of trauma involved, I think is really important. Can you tell me a little bit more about like the process for your team? For how long does it take to do like a research project? So like, I know you had mentioned, or Rachel had mentioned, like it can take years, right? So it can be difficult to kind of remember, oh yeah, I did that 3 years ago, right? And now the study, findings have come out. Was that the case for yours, or was it shorter, longer? What was the length of time there for your study?
This was a relatively short study in the world of burn research. I think it was a 2-year study, so not terribly long. And all of our engagement sessions were held in about a 13-month period. So really pretty tight timeline. The subsequent studies that I've been planning are more on a 5-year timeline, so that's much longer, and it's a lot to ask people to sign up for, which is hard. Like you're saying, even if you participate in one period of time, I mean, if you think back to 5 years ago from right now, like I don't think any of us can even remember what our lives were like. So
Or it's hard to
it is
recall,
very
like my burn injury, right? Like 5 years ago, what
yeah.
happened? So yeah, that can be difficult too.
Yeah, and then I mean, you're absolutely right. So I think the timelines are really challenging, especially because thankfully we don't have a lot of compared to other disease processes, a lot of hospitalized burn patients per year in the United States, which is great. That's what we all work for with injury prevention. But it also means that you have to enroll people for many years to get enough participants to really make a difference. And one of the things that burn research has really struggled with historically is numbers, and is being able to design really high participant prospective studies, which means a study that's like you decide to do it and then you enroll patients. A lot of burn studies are, this is what we've been doing. We're going to look back and see what happened to folks. And so kind of shifting and transitioning to wanting to do more prospective studies is a challenge, especially if you're a single burn center who doesn't admit, our burn center here, we admit 500 patients per year. So if you think about numbers wise, if you want to do a several thousand patient study, that's going to take years. That's also why I'm just going to keep going on all my own soapboxes today. That's why multi-center trials are really important. So having multiple burn centers work together so you can shorten that timeline and enroll people faster is important.
Yeah, I hadn't even thought about it until you said it that way. It is good that there's not a ton of burn survivors getting admitted to the hospital, but at the same time, that kind of slows down research if you're trying to hit a certain number of participants enrolled in that study. Because obviously not every survivor will want to be involved, which is understandable, especially early on, like we talked about earlier.
Mm-hmm.
So this may be a dumb question, but I'm curious. Is participating in research something that burn surgeons, or I guess even burn care professionals in general, have to do? Or is that just something that you're passionate about and want to be involved in?
It is not something that you have to do. A lot of people, so I'm in academic medicine. That's what most burn surgeons are. They're usually associated with some type of, university medical center or community hospital. And part of the kind of being part of an academic center is that you either participate in administration or teaching or research. And I have personally chosen to do research. That's where I kind of feel the most, I guess I just feel the happiest. That's kind of weirdly what I've done with my career is I just do the thing that makes me the happiest. And, if it's burn surgery, then I do burn surgery, and I find the most happiness and fulfillment from doing research. I'm not sure I would feel the most happiness from doing research if I did kind of a scientific, kind of in a lab type research, but because I get to surround myself with burn survivors, it's really fun for me. I spend a lot of time not in my research life doing burn camp, and so I just really like to surround myself with burn survivors, and I get to do that through my research. But it's not something that you have to do.
Callie, are you working on any other studies right now in kind of burn survivor research that we may want to know about?
Not yet. I have a bunch of grants that are currently out that should be scored over the summer. So right now I'm actually working on, this came out of actually one of the things that was mentioned in our study by a stakeholder who's not a burn survivor, but someone who works in a burn unit, was talking about the work-related quality of life and the degree of burnout in healthcare professionals. And, to have someone become a burn survivor, you need burn teams and to take care of a burn patient. And those teams, especially after COVID, are really struggling to staff up and gain the experience and expertise because people are leaving medicine. And so something that came out of that was what is kind of the work-related quality of life for people who work in a burn center? And then, because we have a lot of stakeholders, then from that we get a firefighter that's like, well, what's the work-related quality of life for firefighters? So that's our current project, is we're tracking that here in Utah over the next year. And again, this is something where you're asking people, yes, to fill out a survey. Yes, it may have some emotional components. So when you're thinking about that, you want to make sure you're reimbursing people for their time for filling out the survey and providing potential psychosocial support that they might need if anything's coming up.
That's awesome. I love that there's an ongoing, right? You're consistently thinking about new ways to, right, kind of approach the burn survivor care. And that's, I think, what you mentioned earlier about surgeons in general, right? Like, I think there is a very different side from like what you see when I go into the clinic versus what I'm dealing with at home. And I appreciate you recognizing that, because I do think, like, even for my surgeons, right? Like, I wouldn't necessarily always tell them like the things that I was struggling with on the day-to-day at home, but like, hey, this wound is open. And you see patients for such a small window of time that I think it can be really difficult to really understand, right? Like, the psycho and social aspects of what it's like to be a burn survivor, because you're seeing me for such a small window of time to care for something really important, right? Like my wound healing, but we don't have a lot of time to talk through like the other aspects of my role. So I like that you're approaching it from that, because I do think that the surgeons out there in general, right, have a lot to learn from those aspects of burn recovery, because it is just it's not anyone's fault. You're just not involved in those elements of care. And so it can be really, I think, being able to incorporate those struggles into kind of how you're caring for a patient, I think, is really important. So I appreciate that and just want to put that out there, because I do think, right, it's hard as a surgeon, like, you're so focused on what's most important, but there are other elements that may play into effect of like why my recovery is the way that it is.
Well, and I think we're also, people want to do the stuff they're good at. And we spend a really long time learning how to do surgery and close wounds. And, just like when I was a kid and I really liked to read and I didn't like math, I read a lot more books than math homework. And it's the same thing. I think especially throughout our training, if we had a little bit more of the, I call it holistic, I guess, for lack of a better word, care elements, rather than just the very technical problem fix it. Because that's the other real challenge with a lot of the, more psychosocial holistic things, is they don't actually have a fix. People just really need to be heard and supported.
Yeah. If you took 5 minutes, right, just to say like, hey, how are you doing today? Right. Like, it's no one's fault, but like, usually it's kind of looking at your wounds or whatnot, rather than, sometimes like being able to tell you how I'm actually feeling may reveal other things that are going on with my care. And sometimes, like, especially with mental health, whether it's in burn care or not, sometimes people hide it really well. And so I think like taking some time to kind of find out the psycho part of things, like may reveal more, even in just asking, right, those hard questions sometimes. So I think that for me, I wish those questions were asked, because I think it is important. Like, I was okay, right? But like, could I have found maybe more support sooner had I realized that there were some other resources out there? So I do think that's a really important thing that you bring up.
Yeah. And I think too, coming from your surgeon is also like shows how important the mental and emotional recovery is. Like when you go in for your checkups and your nurses take you in, they get you all prepped, but then the surgeon comes in and you're like, okay, it's game time. So like to hear it coming from them, I feel like would just help ease the survivor and caregiver to know that like this is really important. It's not just all physical recovery, that the mental and emotional is just as important. So I do kind of want to switch gears a little bit to your role as a burn surgeon. So I guess like I'm sure every day is different for you, but like, how do you rotate, or how often are you in surgery? How often are you doing research? Like how do you wear all these different hats and do all these different roles?
Yeah, so I think if you've talked to one burn surgeon, you know one burn surgeon's schedule. It's definitely variable throughout the country. And there's 4 burn surgeons here at my institution, and we all have relatively different schedules when we're not doing clinical care. In general, in a month, I do 1 week of ICU and OR, which is, I'm on call 24/7 from Friday morning to the next Friday morning, with the exception of 2 overnights that we get a little break to just get a good night's sleep. That I do that 1 week a month. And then 1 week a month, I'm on what we call our clinic week, which is where I do a recon laser OR. And I cover those 2 nights of call for the people that's the person that's in the ICU. And then I have a virtual clinic and an in-person attending clinic. And those 2 clinic days, Amber, you should talk to my clinic manager, because all my clinic appointments they're scheduled for about 40 minutes because I spend too much time talking to people about
That's great.
not surgery things. So,
I like that. No, I think that's really important. I like never can get mad at any doctor, right? That like, oh, he takes too much time with his patients. Like, I think that's so important, whether it's in burn care or in general. And right, sometimes I think doctors are trying to get through as many patients as they can without getting yelled at for like taking too much time. But I always really genuinely appreciate it.
Well, it also means that my schedule is almost always full for 6 months in advance, but it's worth it. So when I'm in the ICU, I do care for adult and pediatric patients who need critical care. And then any general medical care for those patients. I do all of the surgeries. We operate 4 days a week. We have scheduled time to operate 4 days a week on people who have they're in their first kind of acute hospitalization after their burn injury. And then we also, during that time, we also run a lot of interdisciplinary meetings, family meetings, care planning conferences. And then the other roughly 2 weeks of the month, I spend doing my research.
So go ahead.
Okay. I want to talk a little bit. So I didn't realize you're not just doing adult burn care, you're also doing pediatric care. I'm sure that's a very different approach, right, from kind of the adult burn care, because you're probably getting like both from a surgery perspective, but I'm sure also like in some cases you're not necessarily talking to the child about their burn care, you're talking to the caregiver. And I know we do have a lot of like pediatric care, like survivors, right? Caregivers that are like involved in listening to our podcast. We've had a couple on the show, but when it comes to like that pediatric care, I'm sure that's very different. I'd love for you to talk a moment about like, is there research right involved in pediatric care? Do you find Rachel was a child burn survivor as well? So I think I would just love to know that, right, a little bit more about the differences, because I think that's really important, right, for our even just caregivers to hear. That approach is not the same to my knowledge, correct?
Yeah, it's fair. I mean, there's some obvious differences with, the resuscitation right after an injury. The thought for operative care is different, right? I'm not going to put a bunch of staples that I have to take out of a pediatric patient. So I will sew in all of their grafts. I'll make sure everything's absorbable. I'll make sure they don't have any, trying to minimize the trauma. Unfortunately, there definitely was many years ago a lot of research about burn hypermetabolism in pediatric patients and how they are different. And there's obviously research that's happening in pediatric burn care, but I think a lot of the care that we give from outside of the surgical care is a lot of trial and error at individual burn centers, which is not ideal. It just, if there's not many adult burn patients yearly in the US, there's even fewer pediatric burn patients, and they're very because there's so many different age groups that are injured, it's not like you can just enroll all kids and say, oh, that they're the same, they're going to respond the same, because kids do need different things. We actually, I run our education session for our providers. So weekly we have an hour education, and we had a really great talk from a pediatrician who's both a pediatric hospitalist and a pediatric psychiatrist. And she came and talked to us about normal developmental behaviors in children. And it changes every couple of years. So you have to kind of change your approach depending on the age of the patient. I think in general, the difference is, obviously there are, there's a patient that you must speak to, especially if they're old enough to understand what's going on. You're not going to consent them for a surgery, but they need to understand why they're having surgery. They need to see why they're doing what they're doing, in as much as they're able to comprehend based on their age. And then the adults, it is a very different thing than talking to say you have a wife of a burn patient in the ICU versus the mom of a burn patient in the ICU. And so when I'm talking to those people, especially when I first admit them, I always try to sit down and say, I know this is horrible and this is hard, and I am sorry you're here. I have 4 kids myself. I very easily can empathize with the grief and fear and guilt, quite honestly, that a lot of those people have when their kid is in the burn unit. And I just try to be mindful of that throughout their whole care. I think my unit would laugh at me. I'm always trying to look for they love it, I think, but I'm always trying to look for some magic we can create every time we admit a kid. I'm like, all right, what magic are we going to do? This kid loves bunnies. Who has a bunny? Anybody know anybody who has a bunny? Can we get a bunny in here? This person's having a birthday, so we need a cake, we need decorations, Christmas trees, whatever it might be, just trying to get to know that individual and make them feel seen as a person, not just a patient while they're there in the ICU.
Well, that's wonderful. As somebody, I used to work for Disney many, many years ago, and creating a little bit of magic, you will be surprised, goes a very long way. So I love that you mentioned that, because I think those little magic moments are what, especially as a child, you're going to remember, right? They're going to remember those times rather than the time that they had to go in for surgery. And so that'll make it even better for them. So I absolutely love that you're creating magic for your guests. And I think there's more of that in the world that needs to happen. So I genuinely appreciate that that's something you do, because I do think that will make or break somebody's experience. Now, and I didn't have bunnies showing up at the hospital even as an adult, but I will say even the little bit of magic that my nurses created for me, right? It was something, and we talk about this in the podcast a little bit, but any little thing that you can do to connect with a patient, I think is going to go a really long way. And I think we sometimes forget that, right? How you walk into the room that day, whether it's to offer to braid my hair, and we've talked about that before, or to do something really small, that goes a really long way for me. Maybe I'm tired of eating the same stuff and you've offered to go get a burger for me or something, down in the cafeteria, right? There were little things that my nurses would always do, hey, are you hungry? Do you need? It was always going above and beyond to make sure that my needs were cared for and that I was in better spirits. And I felt like that changed the course of my recovery. And I'm sure it's the same with a pediatric patient. So I really appreciate you saying that, because I do think there's more of that needs to happen in the world. So thank you.
Yeah, we have a child life specialist. That's someone who, I think their job is basically just creating magic. I didn't know it was a job option when I was choosing jobs.
It sounds like I missed out, I guess. Yeah.
But honestly, sometimes I'm like, these adult patients also need an adult life specialist.
Yes.
I feel so badly that they don't get, our adults also get we get pet therapy. So we get dogs that come visit several times a week. And
happy.
It makes you can't see a little dog and not be so happy to get to pet a dog. It's the best.
The last time I was actually volunteering at Orlando Health, they also had a music therapist going into the adult floor, and a gentleman with a guitar who was had a really beautiful voice. And again, I think it's something small that it goes outside of the norm, right? It doesn't make me feel like I'm in a hospital bed, right? Pet therapy is really great. I love music therapy, any kind of therapy. And I appreciate that Orlando Health was doing that. because I do think and obviously I was burned during COVID, so there wasn't a lot happening on my floor, but I think like now that things are starting to open back up again and we are starting to kind of explore more volunteer options. I think that's really important to have, right? Not just for kids, like, and adults, like, and it doesn't have to be anything crazy, right? Like it could just be, like I said, a music therapist coming in and doing some music therapy with our patients and whatnot. And there's quite a few survivors, I think, that we've talked to that have had some music therapy. I remember Ketchy was on our show, and Ketchy had a music therapist that would come in with her as well. And like, you remember those times. Those are the things that you remember that have helped your recovery for sure. So that's awesome.
Yeah. I was going to say too, as you're talking about the magic and creating magic for your patients, you know, I've obviously had so many surgeries growing up, and like, while I was never excited to go back to the hospital per se, I really don't have like that many like horrible memories. Like there are a few times that the pain was insane, but for the most part, like I have like positive or like neutral memories of the hospital. I don't have like, it's not just a bad thing. And just those little small things. Like I remember we'd have like kids, like a play hour or something. I can't remember the name they called it, but like those things also give you something to like look forward to. Like, oh, tomorrow I get to go hang out with my friends again on the floor type of thing. So just like the little things, like we always say, really, really can add up and make a difference.
I love that. I had a little girl a couple months ago, and I walked in and she goes, "Are we going to burn camp again?" And I was like, "We are going to burn camp again." And then her mom's like, she's been so excited about burn camp. Like she talks, basically the minute she got home, she was talking about it. And then her mom goes, but she also tells me all the time that she just wants to come back and stay in the burn unit because the burn unit treats her better than her mom treats her at home. And I was like, what? And she was like, well, Mom, you don't bring me chocolate milk in bed. It's just like,
you don't have an endless supply of popsicles in the freezer that I'm allowed to have for breakfast.
Yeah. I was like, that's such a win. That is what, that obviously it's not everybody. And I don't want to minimize the trauma that people do have, but man, what a win if people, if a child can leave the burn center and feel positive or, even neutral, honestly, like you said, Rachel.
Both as a pediatric, but also as an adult, right? My experience at Orlando Health was unlike anything else. And I will tell everyone I know about it. And it wasn't because, just the surgeons that I had, it was like the experience that I had from the start I got there to the finish. Like, no, it's all about the like team experience. And I think like, if you can have a cohesive burn team from the nurses to the doctors to everyone else that's taking care of you, like that experience is what makes it a holistic. And I think that's what's really important. And a lot of hospitals, like need to listen to, this is like it's not just one person that's going to make or break your experience. It's the entire thing that will really make or break, I think, your experience. And for me, it was just that, like I enjoyed being in the hospital. And how many times can a lot of people say like, I enjoyed that experience? Because it's not always fun, and I have other survivor friends that didn't enjoy their experiences. But I think if you can get, that holistic experience where you're really feeling like, wow, these folks really care about me, it's definitely will change kind of how you feel and your attitude about your recovery for sure. Well, I know we're coming up on time here shortly, but is there anything else, Callie, that you want to share with those that are listening today? We have a wide variety of folks that listen to the show, from caregivers and survivors to surgeons and nurses. So anything you want to share with our broad community that either you're working on or advice or knowledge that you want to share with them?
I think in, going back to this study that I was talking about, and I think in my career as well, one thing that I just want to make sure that everyone hears, whether it be a survivor, a patient, a caregiver, a burn team member, is the gratitude that I have for being a part of this community. It is the gratitude I felt reading those transcripts of survivors and caregivers sharing such incredibly honest, vulnerable, sometimes heartbreaking experiences, but being willing to share that in hopes that, and people said this, that the next person's experience is going to be better than theirs. Just true, altruism and care for this community. And I see that from survivor to survivor. I see that in our SOAR volunteers who come back for peer support. I see that in burn team members. Like I will do anything for my burn team. I am so grateful to be on their team. I'm so grateful that we get to care for patients together. And I know it's hokey. I know that's like not a usual surgeon like thing, but it really is true. I look at the work that I get to do and the people I get to spend time with. And I think if I do this for the rest of my life, I'm going to look back and say, this was a life really well spent. And I don't think everyone can say that. So I'm just very grateful. I
appreciate you sharing that, because there is a lot of gratitude that I also have for our community, right? It is a very different group of people. And I've said this before, but when I became a part of the community, one of my good friends says, like, this is the best club you never wanted to be a part of. And it is really true, right? Like nobody wants to be a part of this club, but once you're here, you'll be glad you're there. So it is definitely a beautiful community of folks. Well, we always ask our guests 2 final questions before we close out the show. And I guess my question for you, again, knowing that you work with both pediatric patients, but also, adult survivors, is there any one thing that you want caregivers in our community to know? Little piece of advice or something that you want to share with them?
I think for any caregiver of a patient and survivor, they should remember that they do not control this person's story. And the way places where I see their tension and hardship is that a lot of people have to walk their own road, and no one is going to fix it for them. And you can't snap a finger and make it better. They're going to have to get there. You just have to be there. It's, your presence is it. That's what you're doing. And that support and sitting sometimes quietly in the horrible moments is truly the most you can do for someone.
Mm-hmm. That's amazing advice and something new that we haven't heard before, but so true. Just like you said, just being there, holding their hand, sitting next to them in the hospital room, little things like that can, like we said back earlier, the little things can really make the difference. Coming in, bringing them a treat or something that they want, just those things can really, really make or break a survivor's day. So with that said, it is time for our final question, which is our Phoenix Partner question, which today is sponsored by the DC Firefighters Burn Foundation, an organization dedicated to improving the quality of life for burn survivors through programs, education, and research. What is the one thing that always brings a smile to your face, no matter how tough your day has been?
Thinking about camp. I do this thing when people, or thinking about, we call it a tunnel of love. So when someone's leaving the burn unit, the whole unit lines up on 2 sides of our hallway as you exit. And we cheer and clap. We have a bubble machine and lightsabers, and we cheer for the patient as they're getting to leave. And when someone is admitted, and it's someone who has sustained a large burn, and maybe they're very sick, and I'm thinking, oh my gosh, like I can get caught up in like they're gonna have to go through so much to get better from this. I will just stand there and I will close my eyes and I will picture them at camp, or I will picture them walking through their tunnel, and like it literally like fills me like a balloon. I'll be like, okay, we can do this, and then we just do it. And so that is something that always brings a smile to my face.
Well, that is absolutely beautiful. Yeah, we genuinely appreciate you joining us today, Callie. For those listening, we will most certainly link to our research page, which is where survivors can get involved. I appreciate, Callie, you joining the show today to encourage survivors out there that maybe have never been involved in research before to get involved. There's lots of different projects within the community consistently going on. So we will link to that in the show notes. And we really appreciate your time today, Callie, and we hope to hear more about all the wonderful things you're doing very soon.
Thank you so much. Thank you for the invitation. This was awesome.
Awesome. Thank you so much.
See you soon. Bye-bye.
Thanks so much for tuning in to this episode of Girls with Grafts. If you are enjoying this content, please feel free to rate, subscribe, and leave a review wherever you listen to your podcasts. This helps others find the show, and we greatly appreciate it. Thanks again for listening, and we'll catch you in the next episode.